Awesome. Okay, so I don't have any slides or anything like that to share, but just to give a quick overview, so we are the mobile crisis response team for Pinellas County. We are run through Eleos, again, formerly PEMS. We have been operating since about 2018. If anybody had previously had interactions with the mobile crisis response team when we first started, we were only for the ages of 25 and under. Around the time of COVID, we did open that up to all ages. So we serve anywhere from, I believe we've had 2-year-olds recently into the 90s. So all ages services are available. We follow what is called the no wrong door model. So mental health crisis, housing crisis, utility crisis, anything like that. It's because whatever the client considers a crisis, we will consider a crisis. We have a 24/7 hotline. You can call into it. The client themselves can call into it. Neighbors can call into it. Call about family members, strangers, a client that you're working with. Somebody will answer the phone. They'll collect the information, and we get out to that person wherever in the community within 60 minutes. We meet people at home, at their jobs, in the park, wherever they're most comfortable with. The services that we provide include de-escalation, crisis intervention. We'll provide different assessments like the Columbia Suicide Severity Scale, the PHQ-9, self-sufficiency, and then we do create a safety plan with every client that we come in contact with. The main goal of our program is to divert from a Baker Act. We average over an 80% diversion rate every month as far as the amount of people that we see versus the amount that we Baker Act. So I believe last month we actually managed an 89% diversion rate, which was very impressive. I was very proud of the team. Once we go out there, we're able to safety plan, crisis is de-escalated. We do make appropriate referrals to whatever services the client is looking for, whether that is housing, resource assistance, utilities, mental health services, whatever they need, we will find the referrals for them, make those referrals for them, and then we do follow up with clients every 24 to 48 hours until they have made contact with the appropriate services that they're looking for. For the most part, it's pretty short term that they spend time in our program, usually about 5 to 7 days, but we stay in contact with them until that entire time and ensure that a warm handoff is completed with whatever program that we were referring to. Again, a pretty quick presentation. If there is any questions specific to the program, I would love to answer them.
Thank you, Michaela. I have a couple of questions to kind of get the ball rolling. About how long would you say, if I called and I said there is an emergency going on right now, about how long does it take for folks to get out there?
It depends on where we're coming from and where the call is. So during the day, we are located in Pinellas County on Eleos campus. After hours, they will be coming from home. So it really depends on where the call is and how long it takes them to get there. We do respond in our own personal vehicles, no lights or sirens or anything like that. So if there's an emergency that requires immediate intervention, we would contact law enforcement or EMS, whatever's needed in that instance, whether it's violence or medical emergency. But we do respond within an hour for emergent calls. We'll get there. We average about a 20-minute response time.
Very cool. 20 minutes is very impressive. So that is good to know. Thank you. We also have a question from Arrow Woodard with the City of Largo, who asks, does your team go out with street outreach team members to meet with clients they know are having mental health situations?
We can. Whoever calls in, if you were to call in and say, hey, I've been working with this person, I know that they've been struggling with mental health, I think they're having a mental health crisis, we can respond with you guys. For the most part, since we are a voluntary program, we do try to get the client's consent for us to come out prior to showing up at their doorstep or wherever they're at. We just don't want to catch people by surprise. If that's not possible, or were worried that us calling would encourage, they scare them off basically, then we might not necessarily do that. If they don't have a phone, there's no way for us to contact them. If it turns into more of like a welfare check kind of thing, we would dual respond with law enforcement, just because we don't know the safety concerns or anything like that. And again, we respond out in our own personal vehicles. We're not law enforcement. We don't have any sort of the protective factors like that. So for our safety, if it's unknown, that we do respond with law enforcement. But if you were to call in and say that so-and-so is having a mental health crisis, you've been working on them with housing, but there's more going on, they don't have any weapons, they've never tried to hurt anybody else, we'd be more than willing to just go on out there.
Thank you. There is also a question from Ms. Teresa Jones, Continuum of Care board member, asking, does your team collaborate with the CALL team, and that is Gulf Coast Jewish Family Services in St. Petersburg?
We do work closely with them a lot. Their director, Tiana, I talk with her regularly. A lot of the time we do have mutual clients. They've been in contact with a CALL team. Now they're in contact with us, or vice versa. We don't necessarily respond out with the CALL team unless law enforcement sends the CALL team. Somebody else, the CALL team happens to already be out there, but it's not a planned dual response just because it's kind of a duplication of services. Too many cooks in the kitchen. It'll be a warm handoff to one team or the other.
Thank you. That is very good information. Do we have other questions about the mobile crisis response team or Eleos Wellness that Michaela can answer for us while we're here? The quietest group I think we've ever had before. Oh, yeah, it's a good question. Sam Picard, our Data and System Performance Chair and Pinellas Continuum of Care board member, asked, just so we say it explicitly, what is the cost for MCERT services?
Yes, thank you, Sam. And also, hi, I haven't seen you in a while. We are free, no cost to anybody, insurance or not. If you have insurance, we don't bill insurance. Everything is funded by our funders. There's no charge to anybody for any of the services that we provide.
That is fantastic. Is there anything else, Michaela, that you think that we should know about either calling as community members, referring as providers, or just generally about your program that you think we should know?
Again, it's to go with the cost. Free, doesn't matter of insurance status or anything like that. If somebody does have insurance, we do take that into account when we're referring to services. So depending, certain providers don't provide services through certain insurance, but we do take that into account when we're making our referrals.
That is all wonderful to know. Thank you so much, Michaela. And if anybody does have additional questions, please go ahead and pop those in the chat. Given what a quiet group we've been today, I'm guessing that our Q&A section is going to be pretty quick here, because I haven't seen any questions come through in the Q&A box for folks, but I do want to note first and foremost that Ms. Arrow Woodard did say she's really excited to share this information with staff members, and that Sam wanted to thank you, Michaela, because the services available through the mobile crisis response team are, to quote Sam, a blessing. So thank you.